or by a government agency. The next slides really go through the eligibility to shop through the connector for individuals and families that are seeking access to private insurance or financial assistance. But here you can see 4 ways. Through the connector, private insurance with the connector, through a health insurer, an online retailer, an agent or broker, through your employer, another person's employer, such as your parent or spouse, and through a government program such as Connected Care or Mass Health. And again, note the note at the bottom that you can apply for government programs such as Connected Care and Mass Health through the Health Connector. Right. But we just wanted to indicate the 4 different ways that you can get health insurance. So again, this might be a little bit basic, but I just want you to again, keep in mind is how you might be able to use this in your day-to-day work. So how can you get health insurance? To be able to buy private health insurance with the connector, as you know, a consumer must be a citizen or lawfully residing in the U.S., not be incarcerated, they must reside in Massachusetts or intend to reside in Massachusetts, as well as Indian status is not required to shop, but there are special cost-sharing rules that apply to American Indians and Alaska Natives enrolling in coverage through the Health Connector. To be eligible for financial assistance to help pay the cost of private health insurance through the connector, a consumer must, in addition to what we just talked about above, earn at or below 400% of the federal poverty level, the FPL, not be eligible for other government programs such as Mass Health or Medicare, and not have access to affordable employer-based insurance, or ESI we've also called that meets the minimum value requirements, which is, as you know, 60% of the AV or the actuarial value that's indicated on the employer's summary of benefits and coverage. And eligibility for Mass Health differs from what we've just talked about above, but generally lower-income Massachusetts residents are eligible for some form of coverage through Mass Health, and additional details will be provided in other trainings if you're not already aware of this. So let's just look a little bit at some terminology. Again, a lot of you may already be aware of a lot of these terms, but for your consumers, a lot of these terms may or may not be new. They could actually be very sometimes confusing because they look similar but they're different, especially if it's for the first time. But consumers will have different levels of understanding, as you already know, and comfort level with the terminology. And some of these terms are things like plan network, provider network, premiums, co-pays, deductibles, the formulary, HMO, and PPO.